Hey everyone, how's it going? My name is Jeff and I'm an occupational therapist who works in the hospital often with patients who've had a stroke. And today I'll be going over transfers, which is basically a fancy word for how to get from point A to point B using basically a squat method and not fully coming into a stand. And if you haven't already, I highly recommend that you watch my video on just general concepts and considerations and safety of transfers before you actually do this, because it highlights very important points that I'm not going to go over in this video, or it's going to be like super long. So with those concepts in mind and already set up and really thought about and planned already, what I'm going to do is show how you can do a squat pivot transfer into the direction of your stroke. Because in the real world, yeah, while it makes sense to go towards your strong side, just like how I talked about in that introductory video about transfers, it's not necessarily possible or feasible, or is it necessarily best for your recovery in terms of long-term over your stroke recovery, because you want to pay attention to your stroke side, you want to use your stroke side, because if we ignore it and forget it and neglect it, then yeah, it's never going to get better, right? So I'm going to go over how to do this myself because I don't have a helper. Maybe I'll put in a dummy to stand in later, but how you would do a squat pivot transfer, and those of you who do not feel comfortable doing it whatsoever, don't feel safe, feel like you're going to fall, please have the help of a caregiver, somebody to spot you at the very least. I don't want you guys to get injured watching a video from a stranger like me on the internet. I'm going to run down kind of like a checklist that goes on in my head, and it's also a sequence that I go and teach patients and their caregivers. This isn't a hard and fast, like this sequence is the best. It's just make sure you check off all these things in your head in kind of like a flight checklist before you take off and transfer using this squat pivot technique. First is, well, are your surfaces locked, right? So I know my bed doesn't move, it's not on wheels, it's not unlockable. Okay, fine. But if those of you who have a bed that can unlock, make sure it's locked. Okay, this chair isn't like a one that's on wheel either. It doesn't have casters. It's not an office chair. I know it's not going to get away from me. Also, I'm on carpet too, so it's definitely not going to slide as much compared to, say, hardwood. Those of you who have a wheelchair or something on wheels, make sure it's locked, right? It's also pretty close to me, and this chair, this very specific chair, doesn't have an armrest. Those of you who do have an armrest, you want to consider if you're going to run into it. So plan for that. Maybe you want to angle up your chair a little bit or reposition your body relative to the chair so that you do not run over it, kind of bump into it as you transfer using this technique. The next thing is to basically go as close to the surface, edge of the surface as possible. And there's nothing, by the way, to say that I have to do this all in one major movement, right? Kind of like, I don't know, like gymnastics, like you do a twirl or I don't know, whatever it is, right? You can do it in very small increments, and there's nothing wrong with that. Nobody's here to say you can't do that. You can do it in one movement or two or three or four or however many it takes, as long as you're doing it safely, right? So to do a squat pivot, I'm going to demonstrate just a general concept of it, and it's going to look really smooth, right? Because I'm going to demonstrate on video how it's kind of like properly done. But when you're practicing, it may not be as smooth. It may be less refined, less finesse, and maybe a little bit more uglier, right? So don't let that discourage you. Don't be discouraged if your transfer doesn't look like mine. A lot of patients starting out practicing their transfers are going to be kind of looking sloppy, and that's okay. So first thing you want to do before you actually do the transfer is to make sure your area is clear too. So are there any cords that are going to trip me? Is there anything I'm going to slip on? Is the floor wet, right? So I'm pretty much all clear here. There's nothing on the ground. Those of you who have like socks that may be more grippier, like those anti-slip socks, if you find that that helps you a lot, especially if you're on hardwood, put those on, right? Or have someone help you put that on. You can get the most advantage that you can, and that includes your grippiness on the ground. Then the easier it will be, and the less anxiety you'll have and your caregivers will have as you're transferring too. And next is to get as close as possible to the edge of the bed. So for example, if I'm just starting off like this, it's going to be a big movement from here to the chair, right? So why not kind of get closer? Right, you can kind of scoot or nudge or however you think you can get to the edge of the bed. Sometimes you can pull towards it. Sometimes you can even lean forward and kind of scoot. Another trick you can do is kind of offload the weight from one side of your bottom and then kind of create a gap and then kind of shimmy yourself that way. So it looks kind of like this. So for example, if I offload and lean away from this side, I kind of offload pressure, and then I can kind of pull towards that side, and then do the opposite, lean towards my non-stroke side, and then shimmy that across and kind of pivot. This is how I started off, kind of 90 degrees. And now I'm going to pivot myself some more like 45 degrees. And while you're at it, try and move your stroke side leg kind of closer to where it would be when you finally come into that sit position, right? Because if you have, especially those of you who don't have good use of your leg and it doesn't move as well, then you're gonna want to have it not be in the way as much as possible. So that could mean moving it further across, away from you, so that it doesn't kind of get into your way. The next thing to do is, well, what should you do with your stroke arm? If I were to leave it here and kind of transfer and push off, I'd probably leave it behind for those of you who have an arm that's kind of floppy, right? So you can maybe put it on top of your thigh, or you can kind of, if you have, those of you who have some good like pushing ability, like push-up ability, you could put some weight to it, some control. You maybe consider putting it like on the backrest, or maybe using it to reach for where you're going towards, right? I feel pretty comfortable putting it on my thigh, and this is pretty safe in most cases, because those of you who aren't really comfortable with using your arm and reaching across, or you can't even reach across and don't have good use of it in the first place, then this is kind of like a pretty safe position. And those of you who are actually wearing a sling, you could probably leave your sling on because you're going from point A to point B. But if you're gonna ask me, hey Jeff, would you recommend that I put a sling on if I have pretty good control of my arm, it's gonna stay with me here at all times during the transfer, then you probably don't need a sling. But if your arm is like super floppy and you put it somewhere and you don't have much confidence in your arm staying there, and you're going to transfer and you worry about it getting caught or dragged or pulled on, and that's definitely a no-no, then yeah, wear the sling for the transfer and then take it off after you get into the chair. So it's kind of a case-by-case basis. But I'm going to leave my arm here just so that it's pretty tucked in and safe. And then this is my non-stroke side, right? I have pretty good use of my arm, and my leg can use as a kickoff. So a lot of times the common mistake when people make is when they transfer, they don't lean forward enough. They kind of lean back or they push, right? I'm not going to go anywhere like this. But if I lean forward, then I offload the weight and I go from point A to point B easier. I kind of can't really like show you in terms of like how this is easier, but you kind of feel it if you're going to do it like in real life, and try practicing and doing it both ways even, right? You kind of like lean back and push. It's going to be hard. You're going to fall back and slide down. You're going to be at risk for sliding off the surface. Versus, even though it's very kind of counterintuitive, leaning forward more makes your life much easier. And I get it. Like there's a fear of you're leaning too far forward, you're going to like fall off, right? But like for me to even like fall like that, I got to lean myself like really far forward. Like, look, at this point is about where I'm going to lose it and fall forward. And this is like really far. Like there's no way I need to come that far forward, right? So you have a lot of wiggle room. And at the very least, if you do not feel comfortable, again, have someone spot you in the very front. And how they can help you, by the way, with spotting is they can kind of block you. And how they block you is they use their legs to kind of put it against your knee so that your leg doesn't slide out across from you. Especially if you're kind of more anxious in the very beginning and you're prone to sliding back like that. You see how my knee kind of slides forward and my leg can kind of slip out from under me. So have someone blocking you at the very least if you do not feel comfortable doing this. So leaning forward here, I want to use my strongest side, but in reality, I'm going to use as much as I can with all of my body. So if I have some good use of my leg here, try and use my leg. From here on out, pretty easy. I can do small movements. And I mean, if you're going to slide off too much and you're worried about falling, you're probably going to land in your chair, right? You're going to have to do a pretty poor job, and that's sliding back. And that's why I say don't lean back, because you're going to be at risk of sliding forward and away from these two surfaces. Whereas if you lean forward and you plan your movement and position yourself perfectly, or at least most ideal, you're going to have no trouble going onto that surface. See how easy I made that look, right? It's because I leaned forward and A saying that we often use as therapists is your nose over your toes. Your nose actually goes over your toes as you transfer in a squat. And it's called a squat pivot transfer because I actually don't come into a stand. I just kind of at most stay into and maintain a squat position. And just to demonstrate really quickly, if I wanted to do it with the variation of me using my arm and my leg as much as possible, my stroke side, then yeah, I would still do it the same way. I kind of position myself almost to a 45-degree. Now I can actually position, almost forgot myself too, my leg so that it's going to be more beneficial where it's at as opposed to getting in the way. Same with my arm. I could probably like reach with it, maybe even pull with it. And opposite side, my strong side, I would push with and do the same thing. Will this work for all cases? No, it's certain situations will make a squat pivot transfer more beneficial, the most best way to do it. In some other cases, it may be that you actually need to come into a stand and fully stand up to transfer from point A to point B. So even though a squat pivot transfer can help with all cases, it may not help with all of your situations and all scenarios, such as, for example, coming from this lower surface to a higher surface. It's going to be still possible to do a squat, but it may be more beneficial in this case to actually come into a stand. So that's going to be content for another video. But if you found this squat pivot transfer helpful and you learned something, please give this video a like, subscribe, as this is YouTube. Give it a try. Make sure above all you guys are being safe. Thanks for watching. Have a nice day and good luck practicing.